A deadly epidemic, opioids. Overdose deaths exploding across America.
Heroin has taken my past, it's taken my present and my future.
The most potent drugs you can imagine.
Fentanyl is 50 times more powerful than heroin.
From cities.
I was born in that hospital, and she died there.
To the suburbs.
Well, a little 7-year-old called us saying my mommy's dying, and she overdosed. That was a hard one.
The number of casualties in this new war on drugs is shocking. Overdoses surpassing the number of battle deaths in Vietnam, and those involving opioids rapidly moving to the front lines.
There's been a greater than 900% increase in opioid addiction.
1,000 plus dying in New York City last year, the highest number on record.
We had to take action right away. It's alarming.
Tamsin Fidel takes us inside the opioid epidemic with this PIX11 News Special Report. The Hooked Generation.
Thank you so much for being with us for this PIX11 special, The Hooked Generation. I'm Tamsin Fidel. We're putting faces on this national crisis, from a grieving mother to grandparents raising babies and the tragic loss of a music icon. We're talking about the human toll, plus the financial cost and the road to recovery with its share of challenges and controversies. If you look at them, the numbers are staggering. Right now, more than 52,000 people die from overdoses each year, with more than 90 people a day dying from opioid-related deaths. That is more than both the number of deadly car crashes and gun deaths. So the question is, how is this even possible? Well, it's because incredibly 5.1 million Americans abuse prescription drugs, and the cost is measured in both lives and dollars. Opioid abuse costs the American economy almost $80 billion a year, and New York has certainly been hit hard by the crisis. With a recent 20% increase in opioid deaths, that number goes up. We start tonight with Mary Murphy, who looks at the victims of opioid overdoses, the survivors left behind, and how this epidemic has taken a hold of an entire generation.
Go Emma, go Emma.
The voice of a Brooklyn mom celebrating her baby's first Christmas.
You're dancing? Come on.
But Nicole Monty wouldn't live to see her little girl's first birthday the following month.
I got the phone call on January 21st. She was brain dead.
At age 29, Monty had taken Percocets when pregnant, and she was back on heroin, staying in the opioid family. Even the 2016 capture of Mexican drug king El Chapo did not stop the flow of heroin into every state in America. The cartels of Mexico trucking and shipping 79% of the heroin that comes to the U.S., often hiding it among fruits and vegetables and furniture. But they've been sending something else, a man-made opioid called fentanyl.
Fentanyl can be 30, 50 times stronger than heroin.
Nicole Monty's fatal overdose was caused by fentanyl, and so was Danny Latterman's OD in Ramsey, New Jersey.
And I said, why? Why? I can't understand why.
Police said Latterman bought the lethal mix from a football teammate's father. The Drug Enforcement Administration says the lab-created fentanyl, frequently mixed with heroin inside drug mills, is driving the stunning spike in overdose deaths.
They make more money when they sell the heroin by putting more fentanyl in, less heroin in.
This is her urn.
Nicole Monty's mother keeps her daughter's ashes in the living room and recalls a talented hairstylist who took her first opioid, a prescription for oxycodone, at 21 for back pain.
These are lousy drugs for chronic pain, yet we have 10 to 12 million Americans who are on them daily.
Vanessa Turk played the Blue Fairy in a video that spoofed Staten Island's obsession with oxycodone. Turk was 8 months pregnant with a baby girl when she was found dead in March 2016. The ME found a cocktail of drugs in her system, including fentanyl. To understand opioid addiction, consider that all our brains have natural opiates that allow us to feel euphoric.
Examples would be like a runner's high, or a sexual orgasm. Drugs of abuse take that normal range and completely explode it.
When states like New York finally cracked down on pills in 2011, after addicts and dealers were doctor shopping to buy painkillers, Millions of opioid addicts turned to heroin, which produced a similar high.
My two parents are on the floor. My sister said they're not waking up.
In March, a 13-year-old schoolboy in Ohio reported that his mom and stepdad, an airline pilot, were apparently dead from a heroin fentanyl overdose. Dad. And this video appeared on YouTube, showing kids coming home from school to zombie parents.
Anthony.
The hooked generation now producing a generation of orphans.
We have a part of him that's alive, and that's very precious.
2-year-old Anthony McGinnis is being raised by his grandparents. His father, Michael, fatally overdosed on a Sunday in November 2015 after surviving a Friday night overdose in the family basement.
We were just like, we did this whole thing Friday, and now we're doing it again on Sunday. We thought he was going to come out of it.
3 of Michael McGinnis's 4 sons have struggled with heroin addiction. One son has a daughter, Gianna, who's also being raised in the household. The only son who hasn't taken heroin is disabled. Donna Maria stayed away from drugs and carried a lot of anger when she said goodbye to her oldest brother, Michael, when he was removed from life support.
She went up to him and she says, "All right, Mike, you're an asshole." You know, she goes, "But I promise, I'll take care of your kid. I'll take care of your son."
And that's just a handful of the families torn apart by this. The question, though, why is fentanyl so deadly?
Well, Tamsin, it's because it shuts down the respiratory system much faster than heroin does. The drug lords don't care. It's much cheaper to produce. You know, before 2015, fentanyl was involved in less than 5% of New York City overdose deaths. Now, Tamsin, that percentage is 10 times higher.
Staggering number in such a short amount of time. Mary, thank you for a look at things. All right, well, that escalation is being felt all across the tri-state area. Dan Manarino breaks down the opioid hot zones, where one mayor is not only trying to stem the tide in his town, but he is also facing the effects at home.
I couldn't think of leaving my son in that cemetery, but I knew it was coming. And I have to say, with much regret now, I actually wanted him to die.
The opioid epidemic is hitting all of us in our own backyards, from the poorest communities to the wealthiest: Long Island, Staten Island, and New Jersey.
It doesn't discriminate against anyone.
Ocean County, New Jersey, about 75 miles south of New York City, has become a hotbed for both dealing and using. From 2013, the overdose deaths have gone up. Way up. Just listen.
We went from 56, 112, eventually 118. Fortunately, if I look at 2017, I think we'll approach the number of 300.
In Toms River alone, the headlines paint the picture of what's happening in this small shore community, which saw nearly 50 deaths in 2016 alone. Even the town's mayor is personally affected.
I have a grandson who's living with us who just got out of jail, 27 years old now. He came home from college, end of 3rd year, totally hooked on heroin.
Do you ever fear that he could die?
I sure as hell did.
On a ride with Toms River Police Chief Mitchell Little, he explains how nearly 20,000 bags of heroin were seized, along with 200 arrests. And that's just in 1 year.
This is one of our hotels where a lot of people like to pay for the hour and deal. One of the things we're noticing is drugs are causing about 80% of our crimes.
But he takes issue with the current laws.
The Overdose Prevention Act was put into effect a few years ago, and that prevents us from charging that person criminally with possession.
Which is where the Ocean County prosecutor comes into play.
Do you think you can arrest your way out of the problem?
Absolutely not. Once that person overdoses, they need to be brought to the hospital. And once they're brought to the hospital, that's when a recovery coach, or that's when somebody's going to approach that person.
But like the story in so many locations, treatment facilities are overcrowded and beds are at a shortage. Take Staten Island, for example. In 2016,
we have 107 OD deaths confirmed on Staten Island. The OD deaths are the tip of the iceberg.
With a population of nearly 500,000, it's become a leader in both heroin sales and deaths.
How widespread is it? How easy is it to get on Staten Island?
Extremely easy. Extremely easy. I would go to every bad neighborhood you can imagine.
27-year-old Nikki DiCristina was a longtime heroin user.
I had one foot in the grave and the other on a banana peel.
There are a few hundred treatment beds for the thousands of users in this one borough. So when Nikki went to get help,
there's a wait. There's a wait.
There is an issue in some ways with capacity in terms of treatment.
He eventually got into a facility on Long Island, an area that has one of the highest overdose deaths in our area. In 2016, there were 220 deaths on the island alone from both heroin and fentanyl.
We have indicted 36 individuals.
In early April, police took down one of the biggest heroin rings in Long Island history, known as the 110 Crew, which sold over 4,000 bags of heroin per week.
Selling to hundreds of people every day, operating 24 hours a day, 7 days a week.
And the bust along what is now being called Heroin Highway is really just the beginning, as prosecutors from these 3 hot zones put a renewed focus on arresting the big-time dealers, which they hope will disrupt the flow of opioid sales.
Up next, racing the clock to save lives. We're in the ambulance with EMTs who are seeing 1 overdose an hour. Plus, the cost in lives, how one mother paid the unimaginable price.
Emergency crews are certainly seeing a huge spike in opioid overdoses. In fact, it's reaching places you might not expect. Mary Murphy is in the ambulance as one New York suburb copes with this new hooked generation.
It can take just a few minutes for them to stop breathing completely.
We had a report of a cardiac arrest. The family told us that the patient had used heroin in the past.
On a recent Saturday in April, EMT Leslie Umali of the Wisconsin Fire Department raced the clock to save a 56-year-old man she'd saved before.
We've had him as a patient before, and we've given him nasal Narcan. If I have a heroin overdose, I could actually give Narcan via the IV.
Intravenously, which works faster.
The Narcan, how much of a difference is it making in people surviving?
Huge.
But when fentanyl is mixed with heroin, 1 dose of Narcan may not be enough.
They will go into respiratory arrest again, and if they don't get more Narcan, then they will eventually die.
The 56-year-old man revived on April 8th died 24 hours later of cardiac arrest.
Suffolk County Police, Operator 934, what is the location of your emergency?
This is the 911 call center for Suffolk County.
Maybe the last 4 years, you started to see it where now it's maybe once an hour you'll see a call for an overdose.
The stats coming out of Suffolk County for opioid overdoses are staggering. 911 responding to more than 1,500 non-fatal ODs for 2016, 444 as of March 31st, 2017.
The average age of those overdosing on opioids in Suffolk County is in the 30s.
And more than 300 people died from fatal ODs in 2016, 85% of them caused by opioids. As of April 1st this year, the percentage of opioid deaths was nearly 80%. Wisconsin, a small district, recently had 2 fatal ODs in a 3-week period.
We responded to the same street for both fatalities. We're seeing entire families overdosing. A year ago, we had an overdose where it was the mother, the father, and a child that was over 18.
The family survived thanks to Narcan. Ambulance driver Joe Caponia told me he's picked up overdose patients as old as 70, but that's not the norm.
I'm picking up a lot more younger age than 35 years old.
Now, how old are the people you're picking up?
I'm going to say somewhere around 17 to about 25.
The EMTs still respond to car crashes, but heroin ODs are killing more patients. Thomasina Savoya remembers one in particular.
A little 7-year-old called us saying, "My mommy's dying, come save her." And she overdosed.
Fatally?
Fatally, unfortunately, yes. We were unable to bring her back.
In the house in front of her 7-year-old?
Yep.
That's hard to watch.
Yep, that was a hard one.
Well, as one child faces the loss of her mother, another parent must deal with the loss of her children. Kirsten Cole shows us how.
You know, heroin has taken it's taken my past, it's taken my present and my future. You know, when you lose your children, you know, that's what you live for, that's your whole life.
Kelly Grimm lives with the most unspeakable grief, having lost both of her boys to heroin overdoses.
I'll never see my children marry, I'll never be a grandmother. I don't get to watch them graduate college.
The drug is a nationwide plague. In Grimm's Long Island town, like most places, it's cheap and easy to find. It took her oldest son first.
This was my son Kenneth and I, Thanksgiving, right before he passed away.
And you had no idea?
No idea.
That's not the face of a heroin addict.
No, it isn't.
But it turns out...
Yes, it was.
That is the face
That's
of
today's
a
heroin addict.
He died in January of 2010 while attending a drug treatment program.
He was never in trouble with the law at all. He never had a problem meeting curfews. He was able to hold a job, had a steady girlfriend. He functioned, but addictively.
And Kelly desperately wants her story to be a warning.
Never say not my child's. Like I said, we didn't know. We had no idea. It's taking away the stigma where people think, well, if they're a junkie, they're an addict. It's a disease.
Her family, devastated, was trying to come to grips with losing one son and then was hit with wave after wave of loss. The marriage did not survive. Both her parents died after health struggles. And her younger son, Daniel, too, was finding it hard to cope and soon found a familiar path.
He started with pills, Xanax, and heroin I don't think was ever really an issue for him. He used it once or twice before, and he didn't shoot, he snorted it.
Then the anniversary of brother Kenneth's death was approaching. Kelly sensed something wasn't right.
He'd never gone to the cemetery before, and he had reached out and written something on his brother's Facebook page too. So he was definitely struggling with that.
What had he written on his brother's page?
Just how nothing has ever been the same since you left. The family's not the same, nothing's the same.
Her fears were realized the next morning, exactly 5 years to the day her older son had overdosed.
I got the phone call about 7:30 from his dad. He had said there was Daniel had overdosed, they thought, and I need to get to the hospital immediately. Got to the room, the curtain was drawn around it, so he had already passed.
It's not something most people would think they could survive.
No, it's not something anyone should have to survive. It's just too much.
And so most days, when Kelly can find the strength, you'll see her here. Do you feel their presence when you're down here?
Sometimes I do, yeah. I feel that they're with me, my heart, watching over, especially the beach. They love the water. They love the ocean. Very often I'll write their names in the sand with a stick, watch it wash away, find it soothing.
Coming up, controversial and experimental, a look at the treatments being used to reduce the death toll in the growing opioid epidemic.
Let's talk about treating these deadly addictions. Some treatments are available over the counter, some are experimental, but the big question is, will they actually work? Dan Manarino is looking at the options.
Morgan was 18 years old when she started using heroin.
I have been completely unresponsive and basically expired 4 times.
She's now 28 and sober, but not before trying every kind of treatment out there.
Suboxone, Subutex, methadone, I was on all of them.
Nikki DiCristina, who we introduced you to earlier, is coming on 18 months clean. He now runs a successful Staten Island barbershop after years of addiction.
Did you know people that died?
Tons. My whole neighborhood.
Morgan and Nikki both tried medication, assisted treatments.
I tried the Suboxone program.
And?
Didn't work.
He then tried a 21-day detox program. 3 weeks not enough for Nikki or most addicts, really.
We have middle-class families who are emptying out their bank accounts to send loved ones to rehabs for 30 days. The loved one comes home, and within a week, they've relapsed.
This time, he tried Vivitrol.
I'm the type of addict that I'm like a garbage pail. I'll take anything. So if I can't get high on opiates, I'll just go smoke crack or I'll sniff cocaine.
Vivitrol didn't do the trick either, and he only succeeded with long-term rehab. Vivitrol did work for Morgan. She literally got a shot at life 4 years ago through a Nassau County program.
I'm alive because of Narcan. I have a life because of Vivitrol.
Opioid abuse comes with a hefty price tag, however, $28 billion annually in direct health care costs.
I was lucky enough to be one of the first people in the Shot at Life program with Nassau County.
Morgan's insurance paid for her treatment, but many don't have any resources. That's where John Brogan, a recovery coach in Toms River, New Jersey, steps in.
They need to be medically detoxed first, and we bring them here.
Brogan, who was a user at one point himself and knows what goes on in the brain, runs a facility out of this church, working with local police the moment an overdose happens.
From the Narcan, it starts with bringing the recovery specialist in, to intervene at that moment of crisis, whether it's in a hospital bed or whether it's in a jail.
Governor Christie is building programs like Brogan's right into his state budget. Christie now appointed by the president to lead the national fight against opioids. In New York, the Healing NYC initiative has just been launched.
We don't want there to be any barrier for somebody to save a life. We want everyone who knows someone who's using heroin or thinks that someone may be using heroin in their community or in their home to get a naloxone kit. We are working very hard to protect New Yorkers, to prevent overdoses from happening and make sure that we do everything we can to protect those who are at risk.
There are more controversial treatment ideas in upstate New York, including the idea of a heroin injection facility in Ithaca that's now gaining some traction. It would allow users to legally inject heroin under the supervision of a doctor to reduce deaths.
The best research on safe injection facilities say that people who use these facilities are 30% more likely to enter treatment.
Not everyone is as lucky as Nikki and Morgan, with millions of Americans unable to escape from the unrelenting grip of opioid addiction.
So, Dan, you bring up an interesting point about the safe injection sites. Is it something possibly that could ever work here in New York City?
We know, Tamsin, there's only a handful really all over the world. And each one of those places, they've actually shown a reduction in heroin deaths, but not necessarily heroin usage or heroin distribution on the streets. So, yes, while there is an idea to have it here in New York City, one Assemblywoman certainly wants to see more research done.
All right, certainly still a lot of questions out there. Dan, thank you so much. We'll be right back.
When we come back, getting answers on fighting addiction and how to help in your community.
We showed you how this growing opioid epidemic is costing communities and claiming lives. Of course, there are no easy answers to this crisis, but there are resources available, and we want to make sure you have them. We put a lot of great information on PIX11.com, on our Facebook page, as well as on our app. You've been watching this PIX11 special, The Hooked Generation. I'm Tamsin Fidel. Thanks for being with us.